All right, we're going to go ahead and get started. Thank you so much, everyone, for joining us. My name is Nicole Duffy, and I'm the Director of Major Gifts here at the Fund for Public Health in New York City. And I'm excited to welcome you all today to our public health talk on the impact of racism on public health and also its intersection with the coronavirus pandemic. And today we'll be speaking with Dr. Torian Easterling. He's the Deputy Commissioner for the Center for Health Equity and Community Wellness, which we fondly refer to as CheckWell at the Department of Health. And he's going to speak to us about the racial and social justice approach that they use to address health equities for marginalized communities in New York City. So just a couple technical notes before I pass it on to Sarah and we get started. At any point, you can write in your questions into the Q&A or the chat feature. If we don't get to your question today, we'll do our best to follow up with you. We're also going to be sending a survey out after the webinar. It will include a recording, and it will also give you an opportunity to write in any additional questions you have and provide us with feedback. The talk will last for about 25 minutes. We are recording, so we'll also send you a copy afterwards. But if at any point you experience any technical difficulties during the call, please let us know by emailing us at info@fphnyc.org. So without further ado, I'm going to pass it over to Sarah Gardner, who is our Executive Director.
Great. Thank you, Nicole, and welcome everybody to Public Health Talks with the Fund for Public Health in New York City. As Nicole said, I'm Sarah Gardner. I've been the Executive Director for the last 12 years. For our returning guests, we're glad you're here. For our new guests, thanks so much for tuning in for the first time. And for you, just a little bit about the fund. We're an independent nonprofit. We work in close partnership with the New York City Health Department to improve the health and wellness of millions of New Yorkers. And we do this by identifying and creating partnerships, public-private partnerships, to secure funding to test out new ideas and launch innovative public health initiatives to keep all New Yorkers healthy. We also share and amplify critical health department messages and highlight existing public health initiatives that are taking place throughout the city that you may not know about. We actually design these talks so you can learn more about the health department is doing, often with little fanfare behind the scenes on behalf of you and millions of New Yorkers. And as Nicole said, today we're lucky enough to be joined by Dr. Torian Easterling. Torian, as Nicole said, is the Deputy Commissioner for the Center for Health Equity and Community Wellness. He's here today to speak to us about what we mean when we say racism is a public health crisis, and talk a little bit about the intersection of racism and the coronavirus, and discuss some of the projects that CheckWell, his division, is working on to address equity, particularly in our most disadvantaged neighborhoods. So Torian, thanks so much for your time, and let's just go ahead and get started. Let's start off by you telling us a little bit about the Health Department's Center for Health Equity and Community Wellness. Describe, if you can, some of the projects you're working on, a little bit about the history, and why this is such an important model to public health in New York City.
On mute there. I'll start with the last question and why this model is so important. As one of the largest public health agencies, sort of naming racism as a foundational factor in adverse health outcomes is important because what we're also identifying and understanding is that this has been missing from research, both social and biological research, and making sure that public health professionals, medical professionals understand their role in really addressing inequities because we know that these inequities show up in our workplace. And so to be part of an institution that's naming it in a very forward and explicit way is leading, really on the cutting edge, and making sure that this is, we're saying that this is important. I do have the honor of serving as a deputy commissioner for the division that includes equity in its name, but certainly operationalizing equity is the agency. That's something that we have to do across the agency. For our division, we're naming equity because, one, we understand that premature mortality, excess mortality is really impacting Black and Brown communities, disproportionately, and particularly communities, low-income communities in New York City. And so in naming this, the inequities around premature mortality, we're tying together the work that we do within our division. And so we have 7 bureaus, and our work sort of fits in a couple of buckets. One, really thinking about our place-based work and the work that we do through our neighborhood health action centers, really convening, collaborating, and creating partnership with community partners, developing programs, thinking about how we use our research, and really thinking about shared metrics. Also, we are also really pushing to bridge public health and healthcare, which is important because when we talk about health, a lot of health dollars go through our healthcare systems, which is also very problematic because as a public health agency, we pride ourselves on really pushing primary prevention. But if we're only talking and funding healthcare systems, then as a nation, we're focusing on secondary and tertiary prevention. We cannot wait for people to be, gravely sick and almost on their deathbed for us to really help them. We have to think about and invest in primary prevention. And so bridging public health and healthcare really calls for our healthcare systems to think about the work that they need to do outside of the 4 walls of their institutions and what do they do in their community. And also we push on big tobacco, big sugar, and big salt. We know that there are a lot of dollars to corporations who are really predatorily marketing in Black and Brown communities around sugar, around tobacco, particularly our youth. So what is our role as an agency to ensure that we're protecting vulnerable populations, which even include our older adults, and making sure that they can live a fruitful life? I think, Sarah, you're on mute.
Oh, I'm on.
Hey.
Can you hear me now?
Yes.
Okay. Thank you, Torian. You're clearly doing some very important work. So most recently, you wrote a really beautiful and powerful op-ed that was in Time magazine about your experience as a Black man, as a doctor, recently a new father, and a leader in public health in this huge city. Can you tell us a little bit more about what motivated you to write that article and what you hope people will take away from it?
Sure. It was a timely piece, certainly a moment that many of us will continue to ask ourselves, what did we do? What could we have done in the moment? And we're still in that moment. It is a memorial as well as a call to action. It's a memorial because George Floyd, Kamani Gray, Philando Castile, they were all fathers. And that means that their children are now in this world without fathers. And as I wrote that piece, I thought about my daughter, and I was thinking about Rashard Brooks, who is now dead and has left his children, and just because he was in the parking lot and sleeping. And so we continually have to ask the questions about, do our lives matter? And I wanted the world to understand that my life is so important, and not only because I'm here to do purposeful work, but this child that I now brought in this world with my wife Diane needs me, and I have to keep my promise to her. And so the call to action is not only for us as individuals, but it is for this system that has been created, this country that many of us love and continue to fight for. And because we constructively criticize this country, that's only because we want to make it better. And I think that we have that duty and that responsibility to continue to call out and ensure that every individual has the right and the opportunity to live out their full life. And so that was the call to action. And there have been so many people who have put their lives on the line, Black doctors, Black men, like Dr. Ronald Herrera here in Brooklyn at SUNY Downstate, who worked in the emergency room and continue to go to work, even knowing the risk of COVID-19, and is no longer with us. And so it was a homage, but also a call to action, because those of us who are here, we have to do the harder work. because we're still alive and we have to push and carry the torch. And those who are passed on, it is their memories that push us on.
Thank you, Torian. And for those of you who haven't read that powerful piece by Torian, I encourage you to do so. Thanks for writing it, and congratulations again on the birth of your daughter.
Thank you.
So, to raise public consciousness about racism and public health, racism as a public health crisis. As a public health professional, what are you hoping to see, and what are you wary of as this conversation picks up steam?
So I'm hoping to see that more health departments, more government agencies are making the commitment. And that commitment, I think it can come in a number of different ways. We know that there's a lot of work that needs to happen. For government agencies to make that commitment, we have to normalize sort of what those steps are, normalize the conversation, figure out how we incorporate trainings so that leaders, senior leaders, are comfortable in being uncomfortable talking about race and racism in their agencies and in their institutions. And so that's the charge right now, not knowing that we do not have all the answers, but willing to take the step. And I think that's the pivotal moment. That's what I think staff, I think that's what residents and constituents are looking for. Not for anyone to have the answers, but that they're open and transparent. And one, not knowing all the answers and being able to lean into what is uncomfortable. And I really think that, sort of at this crossroad, I hope that leaders are heeding what to do next. Certainly, there's always the concern around losing momentum. I think it's not so much the momentum is going to fade away. It's really saying that if it's not on, not in the media, if it's not on the news, are we still going to do the work? And so momentum is never really lost. There are folks who are always doing this work. And so I never want to minimize and say that we will lose momentum. And we just want to make sure that even when it's not on the 9 o'clock or 10 o'clock, or if it's not being talked about in the media, that we're still going to be committed. There are people who are never going to be written in history books, who are never going to be in front of the camera, but this is the work that we must continue. And so I really do hope that we remain committed to this work and to continue to heed to the call of action and really speaking out against racism.
Thanks. So let's talk a little bit about the disproportionate impact that COVID has had on people of color. Can you speak a little bit about the intersection of the coronavirus pandemic and systemic racism, and tell us what, specifically the health department's doing to address this?
Sure. I think, as most of the viewers recognize, that we have been talking about COVID-19 for all of 2020, small part of 2019. We've been talking about racism now in this country for decades, but understand that the institutions that have built racism, over 400 years, we account for the first enslaved African to be here, arrived here in 1619. And even there are reports that there were others that were brought here in the late 1500s. And so this is something that we know is not new. And so certainly as we see the data related to COVID-19 and seeing the higher rates of mortality among Black and Latino populations, we cannot act surprised at all, because what it's saying is that the longstanding inequities are really the driving factors of why we're seeing disproportionate deaths and disproportionate sickness among Black and brown residents here in New York City and across this country. And so it is really calling for us to think about the structural systems. We want to make sure that, cases are not going up. We want to make sure that folks have access to ventilators and they have access to physicians But we also know that, there are systems that have been inequitable for some time. So not just access to healthcare, but then access to full benefits at their jobs, making sure that living conditions are appropriate, the ability for someone to leave and leave the city, right? We saw the map in New York Times where in Manhattan, so many people had left and they had the means to even get out of the city and go elsewhere. Where in the South Bronx, in North and Central Brooklyn, Southeast Queens, there's no one, they do not have the resources to even move out of the areas where they're currently living. And so there's a risk in just being poor. And so, we really having to call out sort of the inequities in the systems that are leading to why we're seeing the disproportionate rates. And certainly, there was a lot of work that was being done in our healthcare system, but even calling out, how care is even provided in this city. And for quite some time, there have been leaders here in this city, not only Dr. Neil Kalman, even our former commissioner, Dr. Bassett, our current commissioner, Dr. Barbeau, has talked about segregated care in the city, and it played out during COVID-19 pandemic as providers had to make decisions about allocating resources to provide care for certain individuals versus others. And as a result of that, then you open up yourself to bias and how care is delivered. So certainly there's more that we have to do, and there's been a lot of work to name and address those issues.
You're right. Certainly there's a lot more we have to do. And also it shouldn't have been a surprise that COVID hit harder in these neighborhoods where there's a history of health disparities. So we're moving on to a couple of questions from the audience. We have one viewer who would like to know what resources the health department might have available for people who are interested to educate themselves more about the issues you're talking about.
Yeah, I think that there has been a lot of work, even for our agency to really look at tools and trainings. And so I would certainly point viewers to, to the GARE tool, the Government Alliances Resource for Equity, to really think about how they can incorporate these tools and these trainings into their systems and really supporting their staff. One of the ways in which we think about equity is really also thinking about local partnerships in collaborating with organizations that are here in New York City. And so, one of the things that we value are our community advisory boards and our community coalitions. And so, one is not always looking outside. There are certainly resources and expertise within your local environments. And so creating community advisory boards, we created a test and trace community advisory board to help inform planning, because as we're building and strengthening our public health system, we want our community partners to help to inform what that process and how it moves forward. And so certainly thinking about key partners, key constituents, key residents who need to be a part of your planning, as they're also going to bring their lived experience, and they're also going to bring a fresh set of ideas around how systems can really play out to bring them together more regularly. And so certainly think about community coalitions as well. I think the American Public Health Association has also talked about this, one, looking at data and how data could be used to inform, but quantitative data with qualitative data can certainly inform better operations, because you're being really intentional about using the voices of those with lived experiences and figuring out how those lived experiences are going to inform better responses. So certainly there are organizations, both national and local, that are helpful. Color Change is another one. The Movement for Black Lives. Here in New York City, we've been trying to use our data to also inform and make sure that individuals are aware of the inequities that do exist. Most recently, the health department released a preliminary draft talking about police deaths and highlighting additional civilian deaths that were not reported or previously reported during that time period, 2010 to 2015. And so certainly how we use our data can also be helpful for other jurisdictions to think about how you also could highlight these inequities and think about the outcome and what needs to happen afterwards. And then even beyond the health department, certainly our city, again, who is partnering with GARE, thinking about equity and how we are leading with equity. The New York City Commission on Human Rights released a report entitled Black New Yorkers on Their Experience with Anti-Black Racism. And certainly has been important in one highlighting not just racism, but anti-Black racism, and talking about the experiences of Black New Yorkers can also make sure that we're, as we think about inequities and disparities and discrimination, sort of centering anti-Black racism is important in that discussion as well.
Thank you. So I have one more question from the audience. That is, what is the health department and Checkwell team in particular doing specifically to address racism as a public health crisis? I know the health department has done a lot of work internally, externally, how you partner with community groups, and then how is that separate from the health department's work to advance health equity more broadly?
Sure. So one, and I alluded to this a bit already, but I do think our internal reform process, because the work that we've been doing over the past 5 years during this administration to really lead to become an anti-racist organization, and I think that it is very powerful, and it's certainly not always a thought that's going to be well received by everyone, but it is important for us as an organization to say that we are working to become an anti-racist organization, even if it's aspirational. And the work that we're doing to get there includes the 3 pillars that I've been talking about, sort of normalizing these conversations. So doing trainings across all of our staff. There are over 6,500 individuals who are employed at the New York City Department of Health, and working to train everyone, thinking about lived experiences, thinking about the values that people bring to their work and to the conversations that they're in. Certainly, is a process, and there are moments where folks are uncomfortable. There's tension, but we're trying to push through. So that we can facilitate staff conversations even in those moments. And so normalizing it allows us to think about our work. And so that's, again, how we are thinking about organizing ourselves within our divisions, within our bureaus and teams to come together more, think about our planning, how do we operationalize our work? Because the outcome of that will be that we operationalize it and we deepen our work more with our community, with the partners that we work with across the aisle with our sister city agencies, because we really want to think about, we're talking about health, but at the center of health and what that comes out to mean is that people have better housing, better access to parks, better transportation systems. They're thinking about access to their food systems. They're thinking about, access to what does it mean for public safety. And so, even though health is important, we know that, people do not live sort of one single issue lives. These are issues that are impacting other issues, and we need to continue to have conversations around it. So our internal reform work, I think, is powerful in of itself, and I think it's really a strong model. And I think it also impacts our external work. As we, I talked about our collaborations are key. Really working not only with city agencies, but also working with our community-based partners. And so the work that we do in our action centers, making sure that we're not only funding organizations, but we're finding ways to create opportunities for shared leadership, and really thinking about beyond just, hey, we're sharing information, but really we're thinking about what does it mean to have shared measures of success. And so through our action centers, we continue to have opportunities where organizations have already taken up space in our centers, and we're working together. But even during COVID-19, this is an opportunity to think about our response in those neighborhoods. And so we've been working with them to identify points where there are challenges, where there are barriers, and really coming together and figuring out what that response is, you know, in places like Tremont or Brownsville, or even thinking about in East Harlem. So this has really been an opportunity to think about both tactically how equity can show up, and how do you value peer navigators, community health workers, and all the different types of roles that show up in our community, even thinking about barbershops and the roles that barbershops can play during a response. But broadly having a conversation about structures and systems. And I think that this is the work that we as a health department are doing, certainly within our division across the agency, but it's also happening with other city agencies as well. So this is a strong opportunity for us to lead the way that we need to lead.
Great. Well, Torian, thank you. That's actually all the time we have for today. Thank you, Torian, so much for your time. I know you're really busy. We appreciate everything you're doing, and this has been very inspiring. So thanks again, and thanks to our listeners for joining. We're hoping to do these presentations as often as we can, and we're so grateful to our health department colleagues who take the time to do them. You'll be receiving an email shortly after this call with a link to the recording and a survey where I hope you'll share your thoughts and feedback so that we can take them and improve next time. If you're inspired on what you heard today and are interested in supporting this work, please get in touch with us. We've included a link to our website on the screen. You can get more information and donate. Please be sure to follow us on Twitter, Facebook, and LinkedIn to stay updated and learn about upcoming talks. Thanks again for joining. Have a great afternoon and stay healthy.
Bye-bye.
Bye.